So let's talk about that process of what a woman will face. Options, for example. You told me in the break, because I asked you how many options do we have when it comes to reconstructive surgery. You told me basically there's two. We have a 3D image of a breast. And doctor, if you could tell us what those two options are and what exactly do you do?
Sure.
Okay.
So typically when a woman comes for breast reconstruction, after mastectomy, she has two main options, whether to use her own tissue or to use implants. During the time of surgery, the breast surgeon removes all the breast tissue and some of the skin, and depending on where your cancer is and the level of comfort of the breast surgeon, they might or might not be able to save your nipples.
Okay.
So as a plastic surgeon, what we're really left with is just the outer skin. And for us, it's our job to sort of recreate all that tissue that's removed. And on this image, all that yellow part is pretty much what is removed during mastectomy. And traditionally, using the implant will give you that sort of roundness to give you the breast shape. And some women choose that option because that surgery typically takes a little bit less time in terms of you just have one place and you have a kind of an implant. Other people sort of don't like the idea of having a breast implant, that they want some sort of more natural tissue. And because the tissue that's removed is really breast tissue, what we found is that a lot of the skin and fat sort of gives you a similar to feel. And if you choose to use your own tissue, you're kind of limited by how your body is. The most common choice that we use is using skin and fat from your belly. Like the video said when Dr. Medina talked about using transplantation, where we move the skin and fat with the blood vessels connecting to them and reconnect them to blood vessels in your chest. Other options are using skin and fat from your inner thighs, your upper buttocks, and sometimes if all those are not options, we can use your skin and fat from your back muscle.